And we'll get started this morning with Dr. Josh Clayton, state epidemiologist, providing an update on today's case count. And then both Dr. Clayton and Secretary Malcolm-Reisen will be here to take your questions. I'll turn it over to Dr. Clayton.
All right, good morning, everyone. We are reporting 32 new cases of COVID-19 today. We have no new hospitalizations. We are also reporting 2 new deaths today. We have 7 individuals who have recovered from COVID-19, and we have 216 new negative tests that have been performed. In total, that brings our case count of COVID-19 in the state to 320 cases. That does include 23 hospitalizations as well as 6 deaths. We do have a total of 98 individuals who have recovered. I do want to make note that we did have 3 cases that have been reassigned from one county to another, from Yankton to Clay County. And that is just the nature of the information. We're providing that as provisional to you, and so some of the information does change over time, and you have seen that. Our community impact map, we have no new updates for today. I'll go ahead and give a brief rundown of our total counts of cases and where they're located. We have 2 cases in Brookings County, 1 in Coddington, 1 in Lyman, 2 in Lincoln, and 26 in Minnehaha County. The age range of cases, we do have 2 individuals in the 0 to 19-year age range, 4 in the 20 to 29-year age range, 10 in the 30 to 39-year age range, 3 in the 40 to 49-year age range, 8 in the 50 to 59-year age range, 4 in the 60 to 69-year age range, 1 in the 70 to 79-year age range. We are adding 20 cases that are male and 12 cases that are female. I would also like to note, and I'll provide this as an update for the deaths that we have. We have 6 total deaths. Those deaths occurred. We have 2 individuals in the 50 to 59-year age range, 1 in the 60 to 69-year age range, 1 in the 70 to 79-year age range, 1 in the 80 to 89-year age, 80 to 89-year age range, and 1 in the 90 to 99-year age range. We have 4 of those deaths that occurred in males and 2 that have occurred in females. And we have those deaths have occurred, we have 2 in Beadle County, 1 in McCook, 2 in Minnehaha, and 1 in Pennington.
Thank you, Dr.
The leader has muted your line. To unmute your line, press #6.
Star 6.
Good morning. Are you taking a question?
Yes, go ahead.
I missed the, there was some interference on the line. I missed the number of total hospitalizations so far.
So we have 23 total hospitalizations.
Thank you.
Yes.
Yeah, for the same reason, would you mind going over the death information again? Had some interference on the line.
Certainly. So we're reporting 2 new deaths today. That brings our total to 6 deaths. We have 2 individuals who are in the 50 to 59-year age range, 1 in the 60 to 69-year age range, 1 in the 70 to 79-year age range, 1 in the 80 to 89-year age range, and 1 in the 90 to 99-year age range. 2 of those deaths were among females, 4 were among males. And the counties where those deaths occurred, we have 2 in Beadle County, 1 in McCook County, 2 in Minnehaha County, and 1 in Pennington County.
Thank you.
Other questions, and if you would state your name and the organization you're with.
This is Jackie with South Dakota Public Broadcasting.
Go ahead, Jackie.
I've been getting questions about how we're able to track, what's the phrase, contact tracing as the number of cases increase. I'm wondering if you can speak to how well we're able to do contact tracing as these numbers rise, especially in Minnehaha and Lincoln counties.
Jackie, this is Kim Alston-Reisden. That's a great question, and it's a key priority of ours to continue to be able to do close contact tracing of any positive cases. We have been able to keep up with the volume. We have a plan in place to surge our contact tracing and contact notification efforts to deal with what we expect to be increased volume as well. So we have a plan in place to do that. We're bringing on new individuals to help with that effort. And so far, we've been able to keep up.
Are you able to speak at all as to what capacity how long you'll be able to keep up, or share a little bit more of what that plan entails?
Well, I can tell you that we'll be, bringing on additional people to help us with contact notification. We already have a text messaging service that we use once we have a positive, or once we have a close contact of a positive. That text illness monitoring system then helps us communicate with those individuals about their symptoms and keep up on that. So we'll continue to employ that. But we, anticipate, keeping up with the positives and their close contacts.
Next question.
This is Joseph Barca, Capital Journal.
Go ahead.
Good morning, y'all. I was wondering, have the new Abbott rapid ID test been deployed, and how is that going? Is that helping you guys? Because we've tested, I think, even with the new negatives and everything added in, we're still at testing under less than 1% for the state. And will the deployment of when will they get here if they're not here? And will the deployment of those, how much will that help with your plan going forward of contacting staff?
Thanks, Joseph, for that question. We have not received the Abbott rapid ID machines yet. I think we anticipate getting the machines yet this week. The issue with those, and I think we've talked about this before, is that there are supply issues to actually run tests on those machines. And so we are trying to procure the needed supplies so that when we do deploy those machines, that we've got the other things needed to actually run the test. So our capacity with those machines will be determined by the level of supplies that we can get. But we, again, remain optimistic that once we get those supplies, that there'll be a really good, part of our testing options. One thing I would just let the group know is that when we look at the number of tests conducted across all states, and we look at that on a per capita basis, South Dakota ranks number 18 among all states.
What kind of, sorry, ma'am, follow up? May I ask what kind of supplies the tool needs? Is it similar to what the labs need with where they need enzymes and stuff, or do they need memory cards or both? Or, what kind of stuff do they need, please?
Well, they're testing supplies that are different than the testing supplies needed by the state public health lab because they're different kinds of machines. They're not memory card or anything like that. They're actually the chemicals that are needed to process the test.
Next question, please.
Ben Chase with the Huron Daily Plainsman. My question is on the tests that we have right now. Is there any way that we have the ability to see the negative tests by county?
We don't have the ability to break out that larger total by county, in part because we're getting results from many different labs, and the level of information that gets reported on the actual patient is not consistent.
Okay, thank you.
JP from KORN News Radio in Mitchell. Could you give us an update on how many ventilators are coming into the state?
This is Kim Alsom-Ryson. I don't have a number that's different than what we talked about yesterday, which is the 525 level. We are looking at other equipment that can help offset our need for ventilators, and so we're actively pursuing options that could suffice in lieu of a ventilator if one is not available.
Thank you.
This is Paul with the Groton Daily Independent. I know I kind of keep track between South Dakota and North Dakota, and it seems like we're running way behind as far as number of total tests. Can you talk about that a little bit?
I'm sorry, I don't know that we have the North Dakota numbers handy right with us. Again, we're number 18 in the country.
Well, like yesterday, they had 490 completed tests, and we only had 248 in South Dakota. So I'm wondering what, are we being more super conservative down here in South Dakota that we're not running as many as we should be?
I don't know that we can speak to kind of the approach that North Dakota is taking, so it's hard to answer that question. I'm sorry.
Next question.